Hi, welcome to the Pain Relief Center again. I'm Tom, Marinaro, the chiropractor here. And we, as chiropractors, work on the spine and hopefully to make it straight and keep it straight. And I'm here to explain this time or emphasize a little more about what we do here. More about comprehensive healing, complete healing. And I think that's important, as after over 20 years of practicing, I realize how important that is nowadays. It's the right adjustment, finding the right chiro, hopefully it's here. Why it's important, because if the spine is not, the joints aren't properly aligned, you just don't get the proper function and flow. Now I want to also explain what comprehensive is, as I mentioned. Comprehensive, in order to keep the adjustment and the joint in proper alignment, we offer other services. And some of them I'm realizing are extremely important. One of them is the exercise consultant and rehabilitative training that we offer here, and that most patients should do while it's in here, whether it's in here or elsewhere. And we'll demonstrate to you some of the exercises we think are important for the shoulder, for the knee, for the lower back, and of course other parts of the body, but we'll show you some of them. And in this center we work together with the exercise consultant, and we offer training, massage therapist, acupuncture, and then we also have supplements, nutritional supplements to reinforce and emphasize joints and tendons and ligaments, depending on what is prescribed for you. Then we also have something else that we offer. We offer orthopedic, orthotic for the insoles for the feet. We have a computer here that does accurate, specific measurements to the foot. You stand on this platform, it takes a picture of the bottom of your foot, and then out comes an orthotic custom made to your foot to protect the arch and subsequently protecting your knee and your lower back by the soft cushion and protection of the entire foot. Besides adjustments, and the adjustments I offer are Gonstead diversified. That's the type of technique I use in this office over the years. That's the way I was taught, and apparently it works. I also use blocking, which is an unforceful technique where you measure and balance out the hips in order to keep the sacroiliac joints aligned properly, so it restores the leg lengths or any leg deficiencies. We also offer part of the rehab therapy. We also offer electrical stim and laser for the joints and the muscle. Now I want to show you one other thing. This is a patient, Allison, and I'm going to demonstrate what this table by Hill can do. It's a intersegmental traction. It separates the joints by intersegmental traction. And a bigger version would be the decompression that some people are familiar with. This does the same, only in a slight different way, but it's the same principle. So I'll demonstrate what this table does. And what it's for, specifically, it's for scoliosis, discompression, and any kind of joint fusion. And it separates by opening up slightly, and I get good results with adjusting after, and also the patient gets good results from the table itself. And sometimes you may need various sessions. We sell sessions of packages of 3, 5, or 10 of them. So now you're going to face down Allison on your stomach, and I'll demonstrate how this table works. Now you're going to reach out here and grab that, and then I'm going to go here. So right now I'm going to show how we stretch the lumbar sacral region. She's going to grab a hold on there, and then now I'm going to traction it out by stretching it. Half the body weight is the traction. And then I come here, and the table now automatically will go back and forth every 5 seconds and stretch to accomplish and unlock any kind of discompression from L1, probably it gets down to the sacrum by stretching. So after the traction, it makes it a lot easier for me to adjust the patient's lower back, and I can get quite good quality movement, even facing down. I get all the way down to the lumbar, lower back region. As you can feel the movement, right? Mm-hmm. Then I want you to turn sideways this way towards me. I'm going to try and get the lumbar sacral joint area by putting you sideways. And again, this is a Godstead diversified way of adjusting. There. Now turn the other way. And that is a very good way of opening that joint and releasing pressure that builds up from all of us from sitting in front of a computer, standing, and any kind of stress that does happen to go to the lower back. And this is one good way of balancing it out. There we go. Thank you, Allison.
It feels good. Thanks, Dr. Tom.
Now, before I end this part of the session, I want to introduce you to Savas, the consultant and trainer and rehabilitative exercise that he prescribes for our patients in here. This is Savas.
Hello, nice to meet you.
And he's going to show you upstairs where he does the training and the exercise to the patients that come into the pain relief center. Upstairs we have our massages, and that's where it's done, so he'll take you there. Thank you. You can go around to me. These are the massage rooms we have. And we have sort of a Tuscan style is the theme we have in the office, just so it doesn't seem so medical. But we do get good results. And we have 6 rooms where we do the massage therapy. And then in here, follow, is where we do the exercise, the rehabilitative exercise.
So here we have the room that I affiliate each individual with the technique that we use here with Dr. Tom in order to rehabilitate from every issue that everybody has. So the ball is the instrument, let's say, is the element that we use, because on the ball we also gain some stability also on our mind and our body. And 2 exercises that I would like to demonstrate right now for the lower back that help to strengthen the lower back muscles, which that's the importance of having a strong body, to get stronger and stronger every time at your lower back, because that's the way how you get more relaxed your joints and that part. The stronger your lower back muscles are, the more strong you are at your daily life, let's say, okay? The important thing is your lower back and your core. This is the foundation of your body. So what can we do about that? We just try in the beginning, and we affiliate everybody with these 2 exercises. So the first one, as I call it, is the bridge exercise. You just roll on the ball. It's a really simple movement, but you just try to keep the ball steady, and you arch your lower back while going down. You inhale, and then you exhale by squeezing your glute and your lower back. So repeat 2 more times. 1 and 2. So in this way, if you do this exercise, you will realize that your glute and your lower back are getting really stiff at that moment, and eventually they get more strong when these exercises will move on. I also have to show you a second one, which it also strengthens your lower back and your glute muscle. It has to do with more with stability, with coordination of your whole body. So the second one for the same muscle groups is the following. You just lean forward, you squeeze your glute and your lower back once more, you try to bring your chin towards your chest in order also to activate the muscles of your neck. And you go down again, up, down, and up. The importance of this exercise is that you don't use at all weights, but with your own body weight, you activate these important muscle groups, which is your lower back, as I already said, and the second most important probably of all is your core. In order to activate your core, we move on to the next exercise. Once more with the use of the ball, you just roll, you place the ball underneath your pelvis, And from that point, you try to keep your chin towards your chest once more in order to keep your head aligned with your spine. And you exhale, you suck your belly button in, and you come up. Then you breathe in. Once more, I repeat, you exhale, you suck your belly button in, and then you come up. Once more, up and down. With this engagement that is going on when you do this movement, you protect your lower back from every lower back tension that you may have. And the fourth and last exercise of all that has to do with everybody's bad form, everybody you can see in your normal life, that they are with rounded shoulders facing the ground. This symptom is called earth symptom, okay? The one that you are falling down, or the, as women used to know it, as the symptom of getting shamed, the shame syndrome, okay? So one movement that has to be performed in order to strengthen these back muscles, in order to keep your shoulders back, is the following. You come up, you rotate your thumbs, and that has the effect of joining your two shoulder blades when you come at this point. So in this point that I'm right now, I squeeze my two shoulder blades, and my upper body, my upper back is getting stronger and stronger. I will repeat one more time, the same movement. I always try to keep my chin towards my chest in order to align my head with my spine and not to hurt my neck muscles. Okay, it's too hard, that's why you hear me busting while I'm coming up. Once more.
That's good.
And these are four of the primary exercises that we do in order to understand each individual, what's going on with his body and what's going on in this center.
Yeah, there's one very impressive exercises which really helps any of us that have posture like this, that those muscles get dormant and everything falls down. So I was just going to demonstrate the exercise to what to do to wake those muscles up and get your posture standing like that.
Even though if it seems really easy, it's not. Because you have to be really flexible at your shoulders and at your shoulder blades in order to perform this movement, in order the band to touch your glute and then to bring it once more forward. It's too difficult to reach that point from here to here. Too difficult, but too good in order.
Yeah. So you probably do 3 sets of 10,
yes.
and that will start to engage and tone the back muscles. Specifically, if you want to know what those muscles should be, it's the posterior delts, the posterior rhomboid type muscles, and that will also counter and balance out the pec major, which is in the front and the stronger muscle, and it also pulls away. Another one, show the people the one like this, and it goes up, because that's also a good one. Then these are different exercises again to strengthen posterior delts, posterior rhomboids, and posterior traps. Now I know the traps is always in the posterior, but I'm just emphasizing pretty much is the back muscles.
Okay. So I'm doing it this way. Okay.
And you breathe out as you come up.
Yes. So in this way we activate our deltoids in a really efficient way, because we keep totally straight our arms, and the only part that activates and moves these dumbbells up is our deltoids.
Correct. So in other words, Sawas, you're engaging and working the all the back part of the muscles.
Definitely.
Not the front, but the back part of the muscles, right?
Mm-hmm.
The deltoids, the rhomboids,
Mm-hmm.
posterior delts. Okay.
Mm-hmm.
Show them also the one you do under your chin, where you come back and you go up and
Yeah,
also tell them about how to breathe.
Yeah, and this exercise is called Arnold exercise, which is deriving from Arnold Schwarzenegger, okay? That was the exercise he was doing for his shoulders, okay? So the exercise is exhaling while we're coming up, breathing out, turning slightly the dumbbells, breathing, and we bring it at the same position. While we're moving our dumbbells up, we are engaging our two shoulder blades in all the way, and we just relaxing at the last point that I bring the dumbbells forward. So now it's engagement of my shoulder blades and relaxation.
That's good. So Savas is going to demonstrate, and because he has enough muscle to show specifically, he's going to demonstrate the posture exercise that we call it, that engages the paravertebral muscles, specifically the posterior delts, the rhomboids, the rectus spinae, and the, I think I said the posterior delts. Show that how it is? And this is what the elastic band, and there's a lot to do, a lot of exercises to perform with this band, which most people wonder what it is, what you can do with it and what it's for.
And the importance of this movement also is to breathe while you do this exercise. Exhale at the hard part, which is bringing the band back, and inhaling when you bring the band forward.
Yeah, I notice how you're engaging these muscles, you can tell. Very good. So, what's the other exercise? You want to do the shoulder blade one?
Yes, for the shoulder blades is also the following, which now we use here our weight, okay, in order to do this movement, and we turn our thumbs up and we come down. We turn our thumbs up and we come down. Also we bring our chin towards our chest in order to align our head with our spine.
So proper technique is very important as proper breathing of these exercises. And as you can see, you will wake up those dormant back muscles in order to balance out your posture and take pressure and stress away from the neck and the upper back. Thank you, Sals.
You're welcome, Dr. Tom.